Have you ever really stopped to think about it? How your health information gets from a simple checkup with your doctor all the way to some life-saving insight? It's this whole journey that's happening behind the scenes every single day. And it's all powered by a field that's quietly changing everything about medicine. Today, we're going to pull back that curtain.
Yeah, we're decoding health informatics, and honestly, it's the perfect description. The invisible engine of modern medicine. It's working away, day in and day out, to make healthcare safer, smarter, and just plain better for all of us. And look, if you want to understand where healthcare is going, you've got to understand how this engine works.
So here's what we've got lined up. First, we'll break down what health informatics even is. Then, we'll explore its 3 different worlds and take a look at how we went from old-school paper files to digital pixels. After that, we'll follow your data on its journey, check out some mind-blowing tech that's already here, and wrap it all up with why your data really, truly matters.
All right, so let's dive right in with the basics. When we say health informatics, what are we actually talking about? Because it's so easy to just think, oh, it's about putting computers in hospitals, right? But it is so much more than that. It's really this powerful meeting point of different fields that is completely changing the game. At its absolute core, health informatics is the science of handling health information. Simple as that. From the moment data is collected to the way it's stored, processed, and finally used, the goal is always the same: to make healthcare better. It's this sweet spot where medicine, computer science, and data science all overlap. And this right here illustrates that idea perfectly. On one side, you have all the tech stuff. Health information technology. That's the hardware, the software, all that big data. On the other side, you have health information management. That's the actual medical records, the policies, the administration. Well, health informatics, that's the vital bridge right in the middle that makes sure all that cool technology actually serves the real-world needs of taking care of people. And why do we need that bridge? Well, the reasons are absolutely critical. We're talking about improving the quality of care you get, cutting down on dangerous medical errors, and just making patients safer, period. It's about giving doctors better tools to make smarter decisions, paving the way for medicine that's tailored just for you, and even helping us discover new, life-saving treatments faster than ever. Okay, so now let's get into how this all actually works in the real world. Because health informatics isn't just one giant thing. It's actually made up of a few different worlds, and each one has its own special focus and a really unique impact on your health.
First up, you've got clinical informatics. This is all about the tools made for your doctor, your nurse, the people providing care. The most obvious example is that digital chart they pull up on the computer, the electronic health record, or EHR. But it's also the smart systems running in the background, the ones that flash an alert if a doctor is about to prescribe 2 drugs that don't play well together. Super important stuff.
Then let's zoom out a bit to public health informatics. Now, we're not talking about just one patient. We're talking about the health of everyone in a community, a city, or even a country. This is the science that allows organizations to track something like a flu outbreak in real time, manage huge vaccination programs, and spot health trends before they become massive problems.
And finally, we have the world you probably know best, because it's the one that's literally in your hands: consumer health informatics. This is all the tech you use every day: the fitness tracker on your wrist, the health app on your phone, that video call you had with a doctor last week. It's all about putting the power of health data directly into your hands.
You know, having this kind of personal control and connectivity is actually a really new thing. I mean, the journey from dusty old paper files in a basement somewhere to having instant access to your data on your phone, that has been a massive, revolutionary transformation.
Just think back. Before the 1980s, it was all paper, a high risk of errors, lost files, and just slow access. Then in the 80s and 90s, we started to see some early digital systems, but they were all isolated. The lab had its own system, radiology had another. The 2000s, that was the game changer, the EHR era, when we started getting those comprehensive digital records. And that brings us to today, where the whole system is supercharged by AI, big data, and something called the Internet of Medical Things, which is basically just a network of connected devices, everything from smart pacemakers to hospital monitors, all sharing information constantly.
So, with this whole modern system in place, what does the flow of your information actually look like? Let's trace the data through a pretty typical patient journey.
It all kicks off the moment you register at the front desk. And from that point on, every single step, the exam, the diagnosis, the treatment plan, the actual procedure, and all the follow-up, every single one of those things generates crucial bits of data. It's like your digital health story is being written, piece by piece, in real time. And check this out. Look at how many people need access to that story to do their jobs. It isn't just your doctor. It's the radiologist reading your scan, the pharmacist filling your prescription, the hospital administrator handling the billing, even your insurance company. And, maybe most importantly, it's you. As the patient, you're getting more and more access to your own records, becoming a true partner in your own care.
Now, this whole complex web of data sharing, it isn't just about keeping good records. It's the foundation, the launch pad, for some truly mind-blowing technologies that are not science fiction anymore. They're being used in clinics right now to save lives.
I am talking, of course, about artificial intelligence. AI has officially graduated from theory and has become a practical, powerful tool that is fundamentally changing how medicine is practiced every single day. You see books like Deep Medicine, and you realize the big idea isn't about replacing doctors. It's actually about making healthcare more human. The thinking is, by letting the machines handle all the complex data crunching and paperwork, we free up doctors to do what they do best: focus on the patient, listen, and provide that compassionate, human connection.
And this isn't some promise for the future. Right now, AI is analyzing CT scans and spotting signs of cancer earlier than the human eye can. It's predicting a patient's risk of having a stroke, letting doctors intervene before it happens. It's helping to customize treatment plans for a person's unique biology. It's speeding up the discovery of new drugs. It's even optimizing hospital schedules so you spend less time in the waiting room.
So when you pull it all together, when you see everything this system can do, it brings us back to one big question. Why does your individual health data matter so much in the grand scheme of things? Because at the end of the day, it's all about collaboration. This quote just nails it. Health informatics is the science that allows everyone, patients, doctors, entire hospitals, to work together better. Your data isn't just sitting in a digital file cabinet. No, it's an active, essential part of this dynamic system. Your information is the fuel that makes the entire engine run.
And that leaves us with a final thought to chew on. We've seen just how smart our healthcare is becoming, all of it powered by this incredible flow of data. So the question for you is this: as this technology keeps getting better and smarter, what is the one problem in your own health journey that you really hope it can solve?